Health Minister Terrence Deyalsingh claims that COVID-positive patients are paying up to $30,000 to be treated with ivermectin and oxygen at home and continues to warn against this practice. He believes this could even be contributing to the number of daily deaths being reported. Sunil Lalla reports.
And people are dying at home after paying these huge amounts of money for something that is no better than snake oil. That's the best way I could describe it now.
There continues to be a reliance on the use of ivermectin, according to Health Minister Terrence Deyalsingh. Speaking at a COVID-19 update on Wednesday, he says frontline doctors asked him to raise the issue again, since they say people are shelling out big money to be treated at home with ivermectin.
You have persons who can afford it. This is the information coming to me this morning, who are paying up to $30,000 to be treated at home with ivermectin and home oxygen. What the doctors have asked me to say this morning is that this is untenable. If you are on oxygen at home, we ask you to come in to a facility to get oxygen. And there is no need to spend $30,000 on ivermectin at home.
The minister also continues to warn against the use of purchasing COVID packs, which he says will not assist in improving one's health to fight COVID-19.
Which has a combination of ivermectin, vitamin B and vitamin C. That is not going to assist you. And it is their view that the continued reliance and confidence being placed on ivermectin is contributing in some way or fashion to the number of deaths that we experience.
Mr. Deyalsingh says the Chief Medical Officer will again write to the Medical Association and the Pharmacy Board about the use of ivermectin to treat COVID-19 patients at home, which he says has no clinical trials showing its efficacy. Sunil Lalla, TTT News.
Meanwhile, 22 additional COVID-19 deaths in the past 24 hours. The Ministry of Health says the persons were 6 elderly males, 9 elderly females, 1 middle-aged male and 6 middle-aged females. 2 of the persons had no known medical conditions. Their deaths take the COVID-19 death toll to 2,973. 579 new positive COVID-19 cases were also reported by the Ministry of Health. Those results were from samples taken between December 31st and January 4th. The total number of active cases is 15,436. 458 patients are in hospital, while 167 are in step-down or transition facilities.